And welcome back to another episode of the Health One podcast. Today I'm feeling a little chaotic, a little sporadic. To set the scene, I don't even know if I'm going to share the video of this because I look mental, I look crazy. I am having one of those days to set the scene, gals. You know, the day where you've put your tan on, it's hair wash day, and you don't want to wash off your tan before you wash your hair because you want to give it enough time to marinate. So that's the vibes we're going with right now. My hair was waved and then I've have it in a bun all day. And bottom line, I should have washed my hair this morning first and then put my tan on. And I said today is the day that I'm recording this podcast, and there is no two ways about it. So this is what you're getting. You're getting the real deal, the real me. So ignore how orange I look, ignore how wild my hair is, but we move. The purpose of today's podcast has got nothing to do with me, but we're gonna make it about me. No, I'm joking. It's mental. I feel like because this episode, I always usually do my podcasts like well in advance. I feel like this is the first episode in a while I've done like real time, except for maybe the moving to Australia, kind of leaving Bali one, which even I was speaking about the past. But anyway, I'm at home in Ireland at the minute, and I'm visiting friends and family, and it is going so quick. Like I had this vision that I was going to be here for like, a long summer in Europe and blah blah blah. Like, no, I'm heading to Lisbon this weekend, which I'm so excited about. Oh my god, it actually looks like I'm not wearing a top because my orange top blends in. LOL. What was I going to say? Yeah, because I'm going to Lisbon this weekend, I'm really excited, and I kind of have that. I'm going out later on, so I kind of have that kind of giddy holiday mode about me, even though I've like 2 full days of work ahead of me. I still have some studying to do. I still have commitments. I've all sorts to be doing. I'm just feeling good. I'm really feeling good. There's been so much like mixed emotions with being home, but like overall, just so grateful to be here. I had this romanticized version of what being at home in Ireland would be like with the weather and seeing people and stuff, and it's living up to that expectation. And I was kind of like trying to be like, no, Orla, come out of this kind of fantasy world that you live in half the time. And yeah, but it's been nice. It's been really, really nice, and I feel really grateful. It's been really interesting to kind of put myself back into an environment that I have been a previous version of myself, and now to try and show up as another version of myself. And yeah, it's been a very reflective, introspective time, but then also such an extroverted time connecting with friends and family and so on. So yeah, it's been gorgeous. um but yeah, today's episode, I'm really bad with coming up with names for podcasts. It's not my forte. So I always name the podcast episodes afterwards, but kind of had to today. Because the focus of this podcast is on, we're gonna go with doctors' red flags. And it's not just red flags, it's going to be about like experiences that I have been collecting from you listening. Anyone that's following on Instagram, there's been question boxes over for the last few years, really. I remember the first question box that I put up about like medical gaslighting was back when I was in Bali in the very, very start of 2021. No, 2022, sorry. So a year and a half ago, I've been kind of chatting about this more intentionally. And to be honest, when I first started chatting about it was very much, there's a lot of anger, not just from myself, but from people that are sharing their stories. And I kind of pulled away from it because I was kind of thinking, is this productive? Is this actually, giving people a voice, helping people share their stories, amazing, allowing them to be seen and heard when they are going to the doctors, that they're not being seen and heard, they're being dismissed or being told it's in their head or being told that there's nothing wrong with them or being misdiagnosed or mistreated. So, it was really value add to a certain point, but then I did have to question, what was I enabling here, or what was I actually trying to change in the world? Because everything that I'm trying to do is to better the world in some way, shape, or form. It is really trying to start conversations, help educate people, help empower people so that they are inevitably becoming the best version of themselves. So we are having these challenging conversations so people know how to move forward. Okay. And we weren't moving forward if I was constantly putting up question boxes of people just sharing their experience. Okay. We were allowing like one person at a time to share their experience, which is obviously gorgeous. but we weren't actually looking at things any differently. So here we are with today's podcast episode because I'm going to call out some kind of random, not random, don't know why I said random, common, common, common red flags or common experiences and issues that you have been dismissed with. I'm going to keep saying you because obviously, um, I've had quite a good few people that were very kindly sharing their stories. Although a lot of people were more than happy to, but it's a sense of vulnerability at the end of the day, you know. Although there's like a lot of rage and it's kind of can be fueled with that, at the end of the day, there is someone that feels lost. There is someone that feels like they don't know what to do next. They feel rejected. They feel not supported. Okay. And that's not what we want. And again, I do want to like start this and I have thought about getting a doctor on to kind of debate this with me, but I didn't want to put pressure on one doctor to speak for the whole industry. And maybe I will do this in the future still. I just thought today's episode I would do solo. But I do very much want to start off with saying she says when it's already 5 minutes or 10 minutes into the podcast. Wouldn't be like me. But you know, I want to start off by saying that like although my journey kind of started off like my journey for anyone that hasn't heard me talk about this 60 million times before has been about a blog that I started sharing with my rage with the medical system, with how furious I was that no one can see this bigger picture. How are people not looking at this holistically? How does nobody connect these dots? How is it right that doctors can charge this amount of money and not help me in any way, shape, or form? Like the outrage. Okay, so this is where my journey started, and it was kind of like a need that something needs to change, something needs to be done. And that has gotten me to where I am today for sure. I am passion filled in what I do. There is so much purpose to what I do, but anger does not help anyone. Like you can't communicate with anger, basically. Okay, the message isn't going to be received by that person, that gets them reactive and so on. And even in like experiences in the doctors, that's how I used to show up with this kind of chip on my shoulder of like no doctor knows anything and blah 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 because I had evidence of that. So like I do obviously I have to acknowledge that like my experience throughout my whole life has been very very unhelpful from majority, I will say a far majority of a large majority, sorry, of all doctors, okay, if not all, okay, because of the types of conditions that I have. Okay. So this is not to say that there aren't some doctors who really specialize in my conditions and they are keeping up to date with the research and they are trying to do better beyond their limited information given in their medical degree or trying to be better with the time that they spend with patients or whatever. There's so many factors. Okay. However, I up until a certain point was not able to kind of see those other perspectives and all I could feel was my pain, my hurt, my outrage. Okay, so I very much acknowledge everyone listening to this is probably going to be a little bit riled up if you resonate with the different experiences in this, and I want to say that's okay. I want to validate that. I want to say you have every right to feel infuriated. You have every right to feel whatever is coming up with you, but I'm going to invite you to take a few deep breaths. Okay. Yeah, maybe we'll start with that because I want to give you that as a little bit of a tool throughout this podcast if something does come up that is triggering for you, so that you can kind of bring yourself back down. Okay, because being angry, while like I said it can get you to a certain place, it's not the appropriate way. You don't need to project that onto others. Okay, so we're all going to take a few deep breaths. I'm going to get you to put one hand on your stomach, so maybe put your left hand on your stomach and your right hand on your chest where your heart space is, and I'm going to invite you, you can close down your eyes if you like, and I'm going to invite you to breathe in from your stomach up to your chest for the count of 4. Okay, and you're going to really follow the depth of that breath from your stomach on your left hand up, 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 right up into your right hand at the top of your chest, feeling your rib cage expanding. You're going to pause then at the top where your hand is, and then you're going to exhale. Okay, so it's going to be inhale for 4, pause for 4, and exhale for 8. Okay, so we'll do that for 3 counts. When you're ready, let's go. Obviously, hang on. Wait. Don't do this while you're driving. Don't do this. If you're going to be doing something that's going to cause danger or harm, do this with your own discretion. I'm not advising to do this unless you're in a safe position stopped and it's okay to do so. Okay. Okay, let's go. You ready? 2, 3, 4, and hold. 2, 3, 4, and exhale to release. 3, 4, 5, 6, 7, 8. And inhale. 2, 3, 4, and hold. 2, 3, 4, and exhale to release. 3, 4, 5, 6, 7, 8. And last one, really deep now. 3, 4, and hold. 2, 3, 4, and really let that out with the exhale. Okay, well done. Well done if you did it. If you didn't, you just listened a longer creep. No, I'm joking. No, told you I'm a little bit giddy this week, which is good. It's really good because it means I'm relaxed. Okay, when you're in your kind of social engagement zone of your nervous system, you're cracking jokes, you're smiling, you're open to connection, you're feeling good. So it's really nice that I've been in that because I do recognize that for a good chunk of the year I've been in a fight or flight because of, big changes in my life. And we don't need to go into that. Anyways, so if at any point throughout this episode you feel triggered, you feel sensation shifting in your body, you feel anxious, you feel whatever, you can just take a moment to pause and do that breathing. You can do that at any moment in time. You can do it when you're getting irritated in the queue. You can do that when you're in the car and it's traffic, whatever. That is your go-to tool that can really help you with regulation. Okay. And the reason I'm kind of giving it that today is because obviously I'm doing my trauma course and I'm really using it as an opportunity more and more to help empower people with these tools because it's such simple things that we can do with our breathing that can really help us massively. Okay. So I think I went on the biggest tangent ever there, as I do. But basically, we want to understand that doctors have got constraints. They have got like there are absolutely ignorant doctors. There are absolutely doctors that don't really give a fuck. Okay. And I have met some of them. And I have also met some and worked with some who are really ignorant. And I remember at one point asking one of them who I really, really kind of looked up to and respected. And I was like, do you think I should go to a nutritionist for IBS? He was like, no, sure. What would a nutritionist do for IBS? Now, this was years ago. Okay. Years and years and years and years ago. However, at that time, that was something that I was finding in research and a doctor had not been up to date with. Okay. So this is just an example. Um, like for a lot of people, it kind of would be the obvious thing to look at and to investigate now is food. When actually sometimes maybe we need to start with the nervous system. So this is how their research can evolve. And if a doctor is not keeping up to date with the research, or it's not their specialty, it's not their area of interest. Okay. So it could be, for an example, like me with nutrition. Someone could ask me some question about nutrition to do with sport. Well, no, I do know a lot about sports performance just because of my qualification. But I'm trying to think of something. What don't I know? I know everything. No, I don't. But I don't know. Sometimes I get random questions in question boxes, and I'm like, oh my god, I don't know that answer. And I used to want to try and find out every single time. Okay, and if I can try and find out and do a bit of research, and it's something I relatively understand, it's going to be easy to access and so on, and I can help someone, I will do that. If it's going to be something far too complex and it's not an area of interest for me, I will be like, I don't know that. And that's fine. I don't know everything. Like health is such a broad topic, okay? And medicine in itself is a field of health. Nutrition is a field of health. Mental health support, exercise. There's so many different aspects of your health. And then within medicine in itself, they specialize in endocrinology, in gynecology, whatever. Okay. So we cannot put this expectation on them to be superhuman and to know fucking everything. That's not okay, right? That's just not something that we can do. No human is perfect. The expectation I think comes from the fact that they can charge money and they're meant to solve our problems. And I think the mismatch comes when their ego comes in and doesn't admit that and say, let me come back to you, or let me look into it, or if this isn't something that I can support you with, let me refer you on to someone else, or whatever. It becomes a lot of the time it becomes like we're challenging them, we're questioning them. they know better. They may just be looking in a textbook. They're afraid to admit that they're human, and they're afraid to admit that this is something that, they don't know, and that's okay. And I think if we all start to move towards that perspective rather than them versus us, and that's why I want to talk about this first and foremost in the podcast, so that we can move forward together. Okay. So what I'm going to do, I have tried to split it up as much as possible into different categories. I've got my laptop open here in front of me, and I also have my shitty broken work phone that needs to go in the bin, because I took the most recent sticker box that I shared yesterday of people sharing their stories, and I'm gonna try and go through the layout of them in as constructive way as I possibly can. I go with the flow quite a lot. I don't really like sticking to rigid structures with podcasts. It's not natural to me. It's not like a natural conversation. I then stumble my words. My L stutter will come back up if I'm trying to do things in order or perfectly or whatever. So I'm just going to flow with this. I'm going to read out some stories and try and talk you through. I'm either going to just read them out for the shock factor, or I'm going to read them out and give kind of an understanding for you, like I mentioned, to be empowering and so on. Okay. So the first thing I'm going to talk about is hormones, because it's probably the most common. Okay. So the first one and the most common one is all to do with the pill. Okay. And like, I've even kind of steered away from talking about the pill too much, unless obviously it's with my clients, because there's always a question: which is the best contraceptive to take? Which is the best pill that won't cause this? Or I have these issues, should I be taking the pill? And, I've kind of spoken about this before on the podcast. I think I spoke about it on the PCOS episode, or hypothalamic amenorrhea. I would have touched on it throughout the podcast. But pretty much, my opinion as it stands with the pill is you have to make your informed decision by yourself. Okay. So for me, my informed decision stands with the pill was not supporting me at all. The cons outweighed the pros for me. I have been able to gain the knowledge to regulate my cycles with my PCOS, regulate my hormones to a point that I have now kind of accuracies pretty much as consistent as I can be with having PCOS, that I would have 27 to 28 day cycles month on month. And that is subject to change because I like to fly across the world a lot, apparently, and just stress or being sick or different things, or forgetting to take my supplements or whatever. Okay. So there can be different factors that can influence that, but nothing too crazy. Okay. Nothing too crazy. Maybe a few days here and there. So I am now in a position where I feel safe and comfortable to not be on hormonal contraceptives. I'm just going to say the pill because it's a mouthful. I'm in a position right now that I can trust myself, my body, and be, sexually active if I want to be, and trusting and knowing what stages of my cycle that I'm at. Okay. And that is something that wasn't the case at first, and was probably a little bit more anxiety induced in not being on hormonal contraceptives for me. But I really value feeling the fluctuations of hormones throughout the month. I had no sex drive when I was on the pill. There's just so much more benefits to me being off the pill, but that's not the case for everyone. Okay. So you have to really weigh up the pros and cons for everyone. So I'm gonna try and steer away from those type of responses. So a doctor is only able to prescribe you with medication. Okay. That's their limit. Okay. They have a duty of care to you. And if they let you walk away without prescribing something and they're liable, then that's a bit of a risk for them. That's my understanding. That's my awareness. Again, I'm not a doctor. I'm not a lawyer. That is just my understanding. And I'm trying to be the devil's advocate here. Okay. But obviously there is a lot of harmful, or you would question, is it a duty of care if they're just dismissing and then just saying, here, take this. So yeah, there's lots of conversations and debates that can have around that. But the first one that I'm going to start with is you need to be on hormonal contraceptives or you will get pregnant. Okay, this is bringing me back to the Mean Girls episode, and yeah, I've definitely referenced this on the podcast before. Don't have sex, you will get pregnant and die. Okay, so this is not true. Okay, we're just going to start off by saying it's not true. 100% success rate tracking my cycle naturally versus being on hormonal contraceptive contraceptives at all, or the pill. And that is now, hmm, we are coming up to 8 years off the pill. Okay, so 100% success rate. And then there's also, just for me personally, by the way, this is not me saying that's 100% effective or any of this shit. Just giving you some conversations. And then also there are people like the pill doesn't is not effective, they forgot their pill, whatever. So there's lots of different things around that. And it's just really like the biggest thing that like I've experienced, and then also in the question box just today, was the shame. Okay. The word reckless was used by this doctor for this patient or this person, and then also with me. You really need to really think about what you're doing. It's really reckless. You could be ruining people's lives, quote unquote, for me. And I was like, sorry. I was like, I track my cycle and it's regular and it's consistent. I know what I'm doing, and I will use barrier methods around ovulation or abstain. And I was like, I know what I'm doing, the pill. And he kept digging and kept digging. And I was like, I know what I'm doing with my body. Can we focus on what I'm here for? I'm pretty sure I had thrush or something. Like literally just give me a fucking prescription and leave me alone. Anyways, so it was kind of like I don't know if that was his way in with the conversation because I had thrush or whatever, but it was just this like anyways, it's just irrelevant, and it's the shame that's there and this scare tactics and so on. And I've heard people talking about how, you know, they're trying now, because you can access abortion in Ireland, that they're trying to scare people and keep them on hormone contraceptives to prevent this from happening, blah blah blah. Regardless of what the reason is, that should not be happening. Okay, your doctor should be there to inform you, to work with you, not shame you and tell you what to do. Okay, like that's just so out of line. It's not even funny. With natural contraceptives, like I mentioned, you can get yourself to a place where you have a regular, consistent cycle and you can track your ovulation window. There's a method called the FAM method, which is fertility awareness method. You can track cervical mucus, you can track your basal body temperature, and you can track then from there your ovulation spike, your rise in body temperature. There's multiple different methods that you can do. So just look up the FAM method. You can also use barrier methods. So just to make sure that you are aware, if you want to be on hormonal contraceptives, you fucking go for it, girl. But just make sure that you are making an informed decision for you and your body, and not being on it because you feel that you have to. Another add-on, I suppose, with that is that you need to be on hormonal contraceptives to fix your periods, okay, or to regain your cycle. Both are myths that I'm pretty sure I've spoken about before, but just in case no one's heard, both are myths, okay? You do not need to, sorry, being on the pill does not give you back your periods. It suppresses your hormones and gives you a false period, a withdrawal bleed. I feel like all y'all are woke as fuck and you kind of know this point by now, but just in case, as always, I'm not going to make assumptions. Yeah, so it does not give you back your period. It does not help you regain your menstrual cycle. It may induce a bleed, but that's not actually your hormones back working that the way that they're meant to. Okay, it doesn't resolve the underlying issue, whether it's something to do with PCOS, whether it's something to do with stress or energy availability or hypothalamic amenorrhea. Okay, there's multiple different reasons why you may not have a period, and just taking these hormones does not actually get the dysfunction in your body functioning again. Okay, so it's really important to, if you're offered the pill, really dig a little bit deeper and see, okay, well, what's my alternatives here? And if they can't offer you an alternative, go elsewhere, because they obviously aren't educated on the female body. And like I mentioned at the start, that's okay. You would argue it's not okay if they are a gynecologist or an endocrinologist and they should know more about hormones, but unfortunately, that's it. Okay. So like I've also gone to endocrinologists and gynecologists for I suppose endo for my PCOS, and the pill was my only option that I was prescribed. And I had to get cells kind of cauterized, burnt off in my cervix with a gynecologist, and I spoke to her quite heavily about PCOS and how I've kind of helped my PCOS. And she was like, "Oh, I didn't know you could do that for PCOS." And I was like, "Sorry." So yeah, it is quite shocking because you do expect them to be able to kind of connect the dots. And again, this goes back to the medical system, that they don't communicate with one another. They specialize in a certain area and they don't get to kind of take a step back and look at things holistically. Now, I also do believe that these things are changing. Okay, I do believe, and I have clients who have great doctors and they're really collaborative. They're even suggesting things themselves, and it's really amazing to see that there is a shift happening. I do think doctors are doing better, but today I suppose we're just going to be focusing on those that aren't, and they are still out there. And um, I don't know if they're old-fashioned doctors. I don't know. I can't speak. But anyway, I'm just here to share your experiences. Okay. A next myth that a doctor has explained was if a client is going to a doctor with irregular cycles, and they said it is quote unquote normal to only get 4 periods a year. Okay, it is not normal to only get 4 periods a year. And in fact, I think amenorrhea is classified as going more than 3 months without a period, without a menstrual cycle. Okay. So I probably should have looked that up beforehand, but last time I checked it was. So yeah, it is not normal to get your period only every 3 months. Okay. So although it might be common, it might be seen by this doctor, it's not normal. As is, I suppose, the range with your menstrual cycle, the total length, you can kind of average from a range from anywhere from 21 days to 40 days plus, and that could be seen as common, but it's not normal. The 26 to 30 days, so 28 days plus or minus 2, is seen as optimal and maybe normal. Anything outside of that is an opportunity to improve your hormones because there may be a reason why you've got longer or shorter cycles. Okay. Likewise, in this case, longer cycles, only having them every 90 days or so, is not normal and it's something worth investigating. And this was, I think, one of my clients that she went to the doctor to get support with this to see if she could get testing done to regulate her cycles and investigate PCOS as well, actually. And that was the answer she was told. It's normal. And yeah, it's not normal. And thankfully, she has come to me and she now has regular cycles. And again, kind of like following on from that, with PCOS diagnosis, this is huge. Doctors will typically box people off, okay, and they will have this understanding of what PCOS manifests as, how it looks, okay, and they'll basically say, you're not overweight, you don't have PCOS, okay, so that will be a typical kind of write off, or you don't have facial hair, you don't have PCOS. Go and have a listen to the PCOS episode if you have PCOS and this is something that you want to learn more about, because there's specific criteria you can meet. And, my manifestation of PCOS versus your manifestation of PCOS can look a little bit different. Okay. So it's really important to, if you do find that your doctor is kind of writing you off due to stereotype, to see if you do align with those symptoms and see if that is something. I'm also going to have actually a PCOS kind of free guidebook coming out soon that kind of shows the different symptoms. So you'll be able to learn more about that hopefully over the next few weeks. And so you're either getting like diagnosed and then offered the pill, or you're being misdiagnosed and it's being told still go on the pill. So it's kind of like you're not actually getting a diagnosis, which can be really impactful because you can actually then start taking adequate steps towards improving your nutrition, your lifestyle, certain supplementation, maybe even some medication if it's appropriate. So this is where you know, the dismissal is really just it's not okay. Um the next one is a controversial topic and I'm kind of hesitant to bring it up, but I suppose let's dig in. The kind of like any client with PCOS just being offered Ozempic or any of those kind of weight maintenance injections, appetite suppressions, and so on. And the reason I have a bee in my bonnet about these is because of the type of client that I will see that has PCOS and is actually severely restricting herself, even though she's in a bigger body. Because this client, and I'm just talking about the manifestation of this type of client, which is multiple different clients I've had the pleasure to work with. They unfortunately carry so much shame. Okay, they carry a lot of this a lot of weight in this weight, okay, because they pretty much have been told that their symptoms, their condition is their fault, and until they lose weight, they're not getting support. Okay, it's this constant go back to the doctor, or go back to the specialist. Oh, you still haven't lost weight? Oh, well, maybe we'll just up your dose of this. Meanwhile, that they are suffering with a myriad of symptoms from nausea to vomiting to diarrhea to all sorts, okay? And my clients have no appetite and they're not losing weight because of the metabolic component and the stress component with PCOS. Okay, so this is where I have a bee in my fucking bonnet about these weight loss injections. Okay, I'm not going to say a whole lot more on that today because I know each case can be very different and I don't want to shame anyone that is taking these weight loss injections. Like, absolutely, like I mentioned with the pill, there is no shame in you. Like, if you have weighed up your options and you are choosing this option to try and help improve your health and so on, there is no shame in that. I just feel that there should be more looked at, or eating disorders screened. Okay, that's not a conversation that's being addressed at all. Clients with previous eating disorders, or maybe even kind of slipping back down that road because they're restricting themselves so much, and this is then their solution. So yeah, it's just it's close to my heart because of my clients that I worked with, and I really just think it is doctors need to do better. And again, I suppose the final thing on PCOS is everyone gets acne and irregular periods. No, they do not. Okay. No, they do not. That is not a normal symptom that we just have to dismiss. Okay. It is great to be, I suppose, normalizing it, and so the person doesn't feel like they're the only one in the world suffering with it, and that we can kind of, connect through that and feel less alienated, and, not feel so like with acne, it's your face. Okay. And I spoke about this the other day. I'm going to do a hormonal acne podcast because, for example, I have a gorgeous little breakout on my chin at the minute. And when I tell you I have no attachment to it right now, okay, no attachment. I do not give a fuck. I'm able to identify what has caused it. I was a very silly gal and I got carried away in the spa the other day. They had lots of testers for LMS and I just started using them because I was like, these are stunning cleansing pads, and I over exfoliated my mouth area. Okay, after just being in a sauna, a steam room, all this kind of stuff. So I'm after effectively triggering the skin barrier. Okay. It's also my period. So my skin would have been a little bit more sensitive at this stage of the cycle. So it's kind of natural to see spots. Okay. What would have happened in the past with having acne would have been a tiny little spot would be this fear that would send me into a spiral of panic because the acne is coming back. Oh my God, not the acne again. And I had a lot of self-worth issues, self-esteem, body image, body dysmorphia, etc., etc. So the acne was really affecting my mental health, and my mental health was really affecting my acne. Okay, this vicious spiral that I was in. So that's something that needs to be looked into. That's something that needs to be supported. Okay. And, acne can be a symptom of PCOS, but it can also be addressed. Okay. It doesn't have to be something that's just normal. It can be supported through managing insulin resistance, managing inflammation, trying to lower androgens. There's quite a lot that you can do. And it's again, this kind of overarching dismissal of women's symptoms and women's experience as normal, as common. And I don't know if it's because they don't have time, if it's because they aren't truly listening, and maybe because they don't have time, they're not truly hearing their patients, maybe because they're a little bit disconnected. Because I feel in the science world, kind of coming from the science world, it's very easy to just read symptoms. It's very easy to just read research, read theory, absorb this knowledge, and not connect it to the human behind it. Okay, it's very easy to do that because it's just very factual. It's very logical. It is what it is. Okay, and then when you actually are meeting clients face to face, that's where, yeah, that connection and that empathy can come in and make it a very different reality when you actually hear people's stories and the knock-on impact that it can have on the rest of their quality of life. And quality of life isn't something that's really treated medically. It's really just like, what's the symptom? What's the solution? Logic, theory, research. Okay. So I do get it. I do get it, but it's about, again, it's, I'm always going to come back to this message. The whole medical system needs to be looked at and addressed. Okay. And again, I'm not trying to change the whole fucking world here today, but I'm just giving you this understanding of what's normal, what's a red flag, and so on. Okay, and the last one, kind of on hormones, is sure, why would you want to have a period anyway? You're lucky not to have one. So let's all sit down for a sec. Let's all just reframe how we view, how we talk about our whole perspective of the menstrual cycle. You are not meant to suffer in crippling pain month on month, so much to the point that you don't want a period. Okay, so I had this understanding when I lost my period. I didn't try and get support with regaining my menstrual cycle for a whole last year because I was like, well, I'm not in pain anymore. Why the fuck would I want to get it back? Okay. And again, this is probably misunderstanding from doctors, and also they don't probably understand how you can support it nutritionally with lifestyle stress, inflammation, and so on. So red flag, obviously, you do want your period. There's a lot of, and they should know this, there's a lot of long term health benefits, sorry, implications, negative health implications if you do not have a menstrual cycle, like osteoporosis, heart issues. There's so much. It also can massively impact your mental health because you're not having functioning hormones, you have a lot of energy, it can encourage injuries and so on. There's so much issues with not having a menstrual cycle outside of the hormonal contraceptive pill, obviously. So that is a major, major red flag, and get a new doctor. And this kind of leads into the bloods. So quite a lot of doctors will refuse to do bloods. Okay. And again, reasons can vary, can be to do with they don't want to, it's too difficult to do these types of testing. um they have to do a specific test first, and if that's if there's a green light, or if there's something wrong with that, then we'll do this next one. Or the biggest one that I will see is to do weight. Okay, quite a lot of clients are dismissed because of their weight. Come back to me when you lose weight. We'll have a look when you lose weight, because they have this association that the weight is the only thing driving a myriad of symptoms, like quite a lot of symptoms, or the whole condition, for example, PCOS, even in the context of IBS. It's always this issue of weight. And I am going to say here today, I'm going to be very um, real. I'm going to be blunt. I'm going to be honest that having excess body fat can be inflammatory. Okay. It can be inflammatory tissue. Okay. I am team body positivity. I am team health at every size. I am team anti diet, and no, sorry, I'm not anti-diet. I'm anti-diet culture. I'm not anti-diet. I support dieting if appropriate for improving your health, but I'm anti-diet culture and fitness culture that shoves this down your fucking throat and makes you stay stuck in this yo-yo cycle for your whole life. Okay. So I am very much in the middle where health is considered. Okay, so say on the left you've got your fitness culture and diet culture, and on the right you've got body positivity and anti-diet. I'm in the middle. Okay, we need context. There has to be room for context. We need to understand multiple players and multiple factors, but weight does not need to be our front and center focus. Okay, weight can be something that is managed and supported alongside your health. If you just look through things through the dieting or through the fitness lens, you can absolutely be disregarding quite a number of elements of your health. And if I give an example, like a lot of clients will come to me and they won't be eating any fats because their personal trainer would have told them that no, you can't eat fats, or minimal fats because they're the highest in calories. Eat all the protein and all the veggies you want, but skim on the carbohydrates and on the, like, fuck that, no way. Okay, so that's where you're completely abandoning your hormones, your skin, like your energy levels, all sorts, by not like allowing yourself to have fat. Okay, that's a basic example. Then on the other hand, okay, so this is diet culture throwing this shit down your throat, and on the other hand, you've got anti-diet and health at every size, and they're great with really like being anti this and really like helping you feel like your life purpose is not to diet or to shrink yourself and so on, so that you support your mental and emotional health. Okay, because is it really healthy if you are skipping social occasions to go on the treadmill and do your cardio and freaking the fuck out over not knowing the calories in a restaurant and so on? Okay, I won't make this whole episode about this today, but is that really healthy? Versus supporting your mental health, feeling good within yourself, accepting yourself. And then also, if you come back into the middle, you can be accepting of yourself and want to change. It is okay to want to change your body, okay? But it's not okay to want to change your body from a place of hate. You want to come from a place of love and respect, okay? So if in alignment with that, that looks like some fat loss, okay? Not to a certain dress size or not to a certain scale weight or whatever, but just to improve your health until you've kind of, supported your symptoms as best as you can. That may be appropriate, okay? So I am not going to be this person here today to say that weight isn't a factor to consider, but it should not, and I repeat, it should not be a reason for dismissal. It should not be a reason for discrimination at the end of the day. Okay. It's this bias. Oh, they're overweight. This is driving all their symptoms. Okay. Well, what has led them to being in a bigger body today? Okay. And what is their barriers for moving forward? Maybe they actually do need support with moving forward past them barriers, and you're just constantly putting the blame back on them, like they're not trying hard enough. They may lack the education, they may have metabolic issues or hormonal issues like PCOS. They may have issues with the relationship with food. There may be so many things that are not being questioned or supported that they are just being dismissed for because of their weight. Okay, so this is really, really important that if there is some sort of weight discrimination that you're experiencing, speak the fuck up. And I know that's very difficult. It's easier said than done. I have a client who I'm thinking about in particular who it's taken her quite a while to kind of stand on her own 2 feet and be able to feel the courage to do so. Because when you have someone that is being an absolute cunt in your face every time you go back for a checkup, it's very difficult to not feel small. It's very difficult to not feel like, a disrespected, unlovable, unworthy human being. Okay. For you to be able to kind of have the courage to stand up for yourself and to kind of ask for differently is so normal. Okay. And it just shouldn't be that way. In the context of weight as well, very, very shocking. Like when I have clients say things like this to me, I'm just like, So one doctor said, you're not taking it seriously. Losing weight will fix everything. You're just fat. Let's just take that in for a minute. Losing weight will fix everything. Okay. You're just fat. So unless you've been living under a rock, I'm going to give you this reminder. If you have excess body fat, you are not fat. Okay. Fat is just stored energy, by the way. Okay. We have built a whole fitness culture, a whole diet culture, a whole lot of shame just from having stored energy in the body. Okay. Your cells have a nice bit of extra energy in certain tissue, and it's too much energy. It's an excess of energy. And we can begin to expend that energy to come back to having less inflammatory tissue and so on and feeling healthier and at your best. Okay. So that's a very much more logical way to think about it that removes any of the shame and the blame. But this, coming back to this of like, it will fix everything. It most certainly will not. It most certainly will not. What about your mental health? What about the stress? What about the emotional eating? Okay. That's not going to go away just because you've lost weight. It really won't. So, yeah. Anyways, there's multiple different perspectives of that, but I'm just going to leave that one there. You've a bit of meat on you. Okay. The doctor said you have a bit of meat on you. She kept going back to the doctor for fertility reasons. Okay. And he said, you have a bit of meat on you. You need to lose weight. And wouldn't do blood tests for her until she lost weight. Okay. I'm pretty sure she came to me after trying for 3 years. And we got her ovulating within, I think, 6 weeks or 7 weeks, which is incredible. Okay. Because she was actually severely undereating and overexercising. Okay. And that was creating a lot of stress on her body. And then also she was like emotional eating. Okay. So this is an example of goal is actually fertility. And yes, he's within his rights to quote the research, or I think it was a he this time. I think I keep speaking as a he about doctors. I do want to mention there's obviously female doctors, and some of these could have been female doctors. So I don't want to gender stereotype. I actually want to correct myself if I have been doing that. I didn't really think about that. I haven't taken note of if it was a female or a male doctor. So I apologize if I have been doing that. Okay, so yeah. Basically this doctor was a he at this time. And basically she had low progesterone. We found her through blood tests. She had just gotten them done before starting working with me. We were able to work on increasing her low progesterone. And she's in a really good place now. Okay. So yeah, there's more to the weight than just telling someone to lose weight. Okay. There's obviously so much more to physical barriers. Like as humans, we operate from a place of emotion, whether it's to like feel pleasure, avoid pain, or because we're uncomfortable or whatever. There's reasons behind why we do what we do. And when you have that sense of like compassion, when you have that understanding of why you're doing what you're doing, you can then obviously put solutions in place and you can have compassion for yourself. Much more supportive way to move forward versus every time you're going back just being told the same message, it's your fault, lose weight, lose weight, lose weight. Okay. So there we go. So on to digestion. Okay. The very, very common one is you need to drink coffee to go to the toilet for constipation. Okay. Actually, I'm going to start with the fucking worst one. A client went to the doctor with constipation and she was told to drink 2 glasses of water in the morning and sit on the toilet. Like, someone remove this doctor's fucking license because you can get hemorrhoids from straining. Okay. You should not be sitting on the fucking toilet until you are ready to go to the toilet. Okay. Like no. And drinking 2 glasses of water, like, sorry, that's not going to make you go to the toilet. Okay. There's multiple components. Again, go listen back to the IBS and digestion podcast. I think it's number 3 or 2 or something. There's so many different reasons as to why someone could be constipated. And like, again, I suppose they are limited in their nutrition. We'll give them that. But even at that, I am surprised they didn't offer laxatives or something because that's typically the go-to. But yeah, that was helpful information. And also this client had IBS as well. So IBS, gut-brain connection disorder. And, we need to look at fiber, we need to look at stress, we need to look at relationship with food, we need to look at all sorts of things, the gut microbiome, everything that impacts IBS as a pretty complex disorder. But the advice here was oversimplified as drink 2 glasses of water. There we go. Okay. And basically a client expressed that she wanted to stop laxatives because it was causing more harm than good. And a doctor told her that's a bad idea. But if you are going to do it, you have to drink a lot of coffee and caffeine for you to be able to go to the toilets. Sorry? So for anyone that doesn't understand why this is harmful, so this client with laxatives, the thing with laxative is, okay, so you can be constipated and laxatives can actually be just stool softeners, which don't actually move it along. It doesn't actually get your gut motility working back to the way it's meant to be doing things. And it can also cause diarrhea. Okay. It can actually cause issues that weren't there in the first place. So, for some people it may work, it may be a solution, but for a lot of people and a lot of clients that I have seen, it doesn't work, it doesn't help. And we actually try to move them towards coming off the laxatives by actually implementing the things that do work first and then seeing that they don't really need them in the end. Okay. So anyways, adding more caffeine as well can be more of a trigger because it can create more stress, more cortisol, and it can also irritate that gut brain connection as it causes you to be in fight or flight if you have anxiety and if you're affected by caffeine that way, which is a lot of people. Okay. Okay, so the next one is mental health. And yeah, this is something that like, I have to say this is the one issue that I went to a doctor before with, and I was actually advised to go to counseling. So I will say that, like, that was the one thing out of all the issues I've had that I was very happy with the support. Okay. So it was the only thing that was like, okay, I'm not going to put you on medication for this. I'm not going to kind of dismiss what's going on. I'm going to give you an opportunity to go to counseling. There's a free counselor in my college at the time, and that's where I went from there. So I will say that was a positive experience. So the stories I'm going to talk about, obviously, if it's a little bit triggering, just a trigger warning, because it's really, it's really not nice to hear. And I kind of left out some of them that were really awful because, just because it's not appropriate, I don't think, for the podcast. So one of my clients asked a doctor about starting therapy and getting a referral, and the doctor said, "Oh, it doesn't really help and there's no point," which is quite harmful in itself. This client did go on to do talk therapy for 11 months anyways, so it was great. But so her comment was, fuck them close-minded GPs. But it is that close-mindedness, and that could be like the stigma. I'm pretty sure this was an older doctor. This could be the stigma that still kind of exists in the older generations, and that's a real shame because obviously she found talk therapy very, very beneficial and very helpful, and that might not have been the end result had she not have gone to talk therapy. Other common ones is really like doctors not asking what's going on in their personal life, or asking why they're feeling the way that they're feeling and so on. And again, like I suppose the barrier or the line is doctors aren't trained in psychoeducation. They may be like afraid or hesitant or apprehensive to kind of start those conversations because they're not sure of how to best support you. So I will kind of maybe be the devil's advocate in this situation, but I suppose it should be something that's kind of spoken about a little bit more rather than she just says just describing me antidepressants. And it's kind of like this dismissal again, that has kind of come up quite a lot through the question boxes that I have received. Another question before as well, this person wanted to stop the pill because they had low mood and felt it was affecting their mental health. And the doctor said, you know, if you stop it, you're going to get pregnant. So it's like, again, a woman's body is only about getting pregnant or not, and quite a lot of things as well, like the only solution being the pill and blah blah blah. And it's just like, sorry, what? I'm coming to a completely different issue right now, and about her quality of life was affected. She didn't feel this beforehand, and obviously there's other factors that can impact your mental health. It's complex, but she is coming trusting her body and speaking her truth, and instead it's just kind of like the shame as well. Okay. Another one as well, the client spoke about how frustrated she was that she kind of went to them after being taking SSRIs, asking for kind of alternative therapies and being dismissed with that as well. So there definitely is still a lot of stigma, still a lot of shame, still a lot of that within the medical industry. Like I said, I myself had a good experience. There's a lot of things I haven't had a good experience on. So yeah, another one said that you know more than they do when they prescribe you steroids for skin issues. So yeah, skin again is a whole other topic in itself. Like I mentioned with acne, it's like really about trying to. Sorry, actually, there was ones about acne as well, about just kind of being told to go on the pill or not, and this kind of fear of you know, not being listened to, and they just kind of read in a book and all this kind of stuff. So yeah, I think that comes down to like not having more of a holistic understanding. And again, their training does not encourage holistic understanding. Okay. Science is very factual, matter of fact. They're also trained with medication. Here is this medication to treat this symptom. So that is where this mismatch can happen. So yeah, I'm trying to think of like what word I'm trying to use, but I think disconnect is the word I want to use. And yeah, I suppose there's just quite a lot of things that are red flags, such as like, this is normal, everybody has this isn't a big deal, not really listening to you, not really doing that further investigation, not really hearing you for what you're saying. And like I said, I would have always gone to the doctors with such a bee in my bonnet of like, I've gotten this tested before. This is not what this is. You should know this. Da 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 da. And ultimately, that doesn't help anyone move forward. What I will always say to clients is that if you are not happy with your doctor, fucking leave. Why continue to give them your money if they're not listening to you? Okay, they do not deserve your business. It's a business at the end of the day, and I think we're very much conditioned, I think, in Ireland especially. I can't speak for any other country, but that like there's a local doctors and we all have to go to that local doctor, and you've got your medical records there for life, and da 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 da. It's a bit complex to move. Even like things like it's complex to ask for your blood's results back and stuff, which I'll talk about in a sec. But it's not. It's really not. You are meant to be supported by this medical professional. And if they're not supporting you, report them if they're doing something harmful, which I'm starting to tell my clients to do if it's really harmful. Um, and or leave. Okay. And or leave, because literally like what I said, you wouldn't continue to go back to a restaurant if the food tasted shit. Okay, you really wouldn't. So why are you continuing to go back to a doctor that's really not helping you? Find a better doctor. And I'm telling you, they exist. I'm getting, like I said, a lot of positive feedback from my clients that are explaining about these doctors that are really hearing them out. They're showing them these new things to do. Some doctors are telling them to go do meditation and go for walks and exercise, and it's fucking brilliant. So yeah. And even with getting blood test results done. So I did a post on Instagram about reasons why, you know, your bloods might be kind of told that they're normal and all is fine and they're not within range, or they weren't done on the appropriate day of your menstrual cycle, or while they're not high or low, they're still not within the optimal range. So with blood tests, well, you might be told that they are normal because, they might be not flagged as high or low, or they might be just borderline high, or they might be, although they're in the range, they might not be optimal. There's lots of different interpretations with blood tests and reasons why. And I did a good Instagram post on that, if I just asked myself, on Instagram, that you can go and have a look at. So I'm going to wrap it up there because, like I said, it was really just, this episode is about sharing people's stories, maybe sharing some perspectives and helping you understand from a doctor's point of view, but then also empowering you to understand what is right, what is wrong, what the myths are, what the facts are. And I really want to thank everyone who has shared their experiences with me. I want to thank my clients for, opening up and sharing these experiences. And, yeah, like I said, we do want to have this vision of not abandoning Western medicine. We need it. We need it so much. And there are definitely people moving away from any sort of trust in the medical industry. And that can be really harmful. That can be really harmful in emergency situations, in chronic illness or cancers or whatever. There are people completely wiping out any sort of trust within the medical industry. And that is, like I said, harmful. We do want to come back down to this middle ground. We maybe want to look at how it's not appropriate to go to the doctor for certain conditions when they're actually best treated with nutrition or supplementation or lifestyle changes or whatever. But ideally, there would be communication and everything would be treated holistically. And it doesn't need to be this either or, doesn't need to be this us versus them. It doesn't need to be this outrage that we're all feeling hard done by because they're money robbing. Believe, no, I'm only joking. But that is, that is a belief that exists. That is how people feel. And I just really wanted to give space to this episode today because I do touch on the medical industry throughout my podcast. And I can't go by without doing an episode on, medical gaslighting, on feeling like you're not being heard, even like with periods. Periods is something that is now being recognized. I think Spain is the first country to introduce period leave, okay, menstruation leave, that you can actually, now I don't know the terms. I don't know if it's like if you're diagnosed with endometriosis and you're suffering with extreme excruciating periods, but there's even like something that came out recently that they have now discovered that women experiencing a menstrual cycle is the same as experiencing a heart attack 3 times or something. And really funny on the memes and the comments and stuff, and it's like they've only now realized this because men are only starting to research this because of the gap with research with women. There's so much missing. There is so much missing. And this also could be playing into why we experience what we experience, why we have medical gaslighting, why we're being dismissed, why we're whatever. There needs to be, obviously, there's again so many elements to why we are in the situation that we are currently. At the end of the day, I hope this episode has helped you understand what is normal, what is not normal, helped you feel a little bit more encouraged, helped you feel like you're not alone, because like I mentioned, this is just scratching the surface of some of the things that I have received and heard. And I kind of wanted to talk about the most common ones, but there's all sorts of batshit crazy things happening out there. Okay. But yeah, if you kind of resonate with anything that was mentioned in this episode and you need further support, don't hesitate to DM me. Of course, I do work with clients on a range of these issues. And if you would like one-to-one support, either through one-to-one coaching or just through a standalone consultation, pop me a DM on Instagram, send me an email, hello@thehealthhun.com, or you can go through the contact form that is in my bio. And as always, if you found this conversation helpful, pass it on to someone who would also find this helpful because, this information needs to be spread far and wide so that these aren't issues people continue to experience. As always, if you enjoyed the episode, I would really appreciate if you head over to Spotify or Apple and just tap those stars. It's really helpful for me. And let me know what you enjoyed about this episode and what you would like to see more of in the future as well, because I think I'm coming up with a little bit of a writer's block and I'm struggling to kind of plan the next season. I like to be ahead of myself, but I'm slowing down with that, which kind of indicates we've got a bit of a writer's block coming, but that's okay. But yeah, I'll see you on the next episode. Bye.